All right, I think we are ready to kick things off. Very excited to be here today. Good afternoon. Thank you so much for joining us today for Population Health Matters. My name is Aaron Perry Zucker. I'm the Director of Strategic Communications at Heluna Health. We are a nonprofit that supports a wide range of programs and organizations across public health, working on everything from maternal and infant care, early literacy, nutrition, and housing to disease prevention. I am so pleased to be here today as we're discussing a really exciting topic, guaranteed income pilots in public health. To quote from the Economic Security Project, guaranteed income is a cash payment provided on a regular basis to members of a community with no strings attached and no work requirements. It is intended to create an economic income floor below which no one can fall. There is significant and growing evidence that direct, unconditional cash is a uniquely flexible, efficient, and swift means of addressing a range of issues, including mental health, physical health, children's school achievement, employment, and earnings in adulthood. The COVID-19 pandemic provided real time data on the ways that cash not only provide immediate relief from financial crises, but can also bolster family incomes and prevent poverty. Since then, guaranteed income pilots have been growing in popularity, including in the public health space. Stanford's Basic Income Lab has a great map detailing 192 projects as of 2024 that are active and all of their results. You can check that out at the URL here. Um, Today, I am very pleased to be joined by some speakers from two amazing organizations with active guaranteed income pilot programs, one in the maternal health space and the other in housing and homelessness. I'll introduce them both briefly before having each of them share a little bit more about their work, and then plenty of time for discussion and Q&A. So to start, Adjoa Jones and Lindsay Richard, both of LA County's Department of Public Health, are overseeing the California Abundant Birth Project's expansion into LA County. After Expecting Justice, a partner of Heluna Health, launched their San Francisco Abundant Birth Project pilot in June of 2021, a coalition of leaders in 5 counties across California are expanding this successful project over the next 3 years with the goal of reaching 950 participants. To date, Abundant Birth Project has served 404 mothers and dispersed $2 million. Also, here with us, Nellie Stasny of Miracle Messages is the director of Miracle Money. Initially focused on family reunification and social support for the unhoused in the Bay Area, Miracle Messages has connected over 900 individuals with loved ones and paired 350 volunteers for regular calls and texts. In 2021, they launched a guaranteed income experiment distributing nearly $1 million and publishing the findings from their study with the USC School of Social Work in November of 2023. So without further ado, I'm going to hand things over to Adjoa and Lindsay to tell us about the Abundant Birth Project. And please feel free to add your questions to the chat. We'll either address them as we go or follow up afterwards to talk some more. So Adjoa and Lindsay, want to take it away?
Sure. Thank you. And thank you very much, Aaron, for inviting us. We're happy to be partnering with Heluna Health for our Abundant Birth Project and a number of our, especially AIM, African American Infant and Maternal Mortality Prevention Initiative projects. And so happy to be here with you as your guest and happy to be here with Nellie as a co-presenter in this work and with my esteemed and wonderful colleague, Lindsay Richard, who serves as our program manager for our LA County Abundant Birth. So super excited and grateful to be here and looking forward to more dialogue and sharing this great work that's happening across our state, not just our county, but across our state, and the imperative need and what we're hoping and planning to do, the course that we're plotting to ensure that women who are experiencing and birthing folks experience the most disparate birth outcomes in pregnancy and birthing have support, have an opportunity to have joyous and healthy pregnancy and birthing outcomes. So what we'll do is Lindsay and I are just going to take you through a few slides that really share with you and give you a picturesque view of our project. So the Abundant Birth Project, very excited to have been a part of this. Very excited for the work that Dr. Zaya Malawa started when she brought the first guaranteed income pilot project to San Francisco with Expecting Justice, where she was serving. Their goal was to serve African American and Asian Pacific Islander women And so the opportunity presented itself through our state uh, CDSS to apply for an abundant birth or guaranteed income pilot program across the state. And so we were one of the counties that were reached out to find out if we were interested in partnering and being a part of that work to show forth the real need to pilot this guaranteed income for pregnant and parenting women and birthing folks, but then really to look at how it could possibly be sustainable. And so the one beautiful and exciting thing about this project is that the development of this project didn't just come about from public health leaders and people who had been in the work a long time. It came about as a result of getting in conversation and bringing folks with the lived experience to be a part of the development and implementation and giving voice to what that guaranteed income pilot should look like and what would be or what they thought would be the benefits and how it would help to support. So really one of what we see with the guaranteed income is also a strategy and intervention at reducing the poor outcomes for pregnant and parenting women. And if you know anything about LA County, then and you've heard anything about AIM, then you understand what we share about Black women suffering from maternal mortality and morbidity at 3 to 4 times the rate of white women, having the poorest outcomes for maternal mortality and morbidity in pregnancy and birthing, as well the same similarly for Black infants. But what we are seeing in guaranteed income is here's a wonderful opportunity to address what we have known to be a challenge in this nation for over 400 years, the economic inequality, and look at a way to provide some support and also to address some of the stressors that come about as a result of economic inequality, as well as some of the just health associated risks that come. We're talking about racism and trauma and not being heard and received when going into healthcare facilities. And this is just what we have seen for those that are having those higher rates of mortality and morbidity. And so, and then we could talk about the high cost of housing, discrimination in housing, and we could just go the historics of this, and it would take more than the time that we have here. So I won't go into all of that. But what is the guaranteed income? It is providing regular cash payments with no strings attached and no work requirements. And so studies have shown that this already improves health. And I can see that to be true. I know individuals who are single who have challenges, even especially in California, with just meeting the basic minimum requirements. We know we have a real housing issue here. We know housing costs are very high, food costs, just all of those things taken into play. And what we want to do is look at a way to mitigate preterm birth, low birth weight, and offering this opportunity to those in our community. And then also looking at our project is a bit different, and Lindsay will go into it, is because we also provide the women with the opportunity to be coached throughout their enrollment into the program once they become eligible and if they're selected in the lottery draw. So we'll talk more about that. Next slide. Our California Abundant Birth Expansion Plan started, the ABP model started in San Francisco with 151 participants. And then, as stated, bringing all across California, bringing the counties together, our goal is to at least, at minimum, provide 950 mamas with guaranteed income through Abundant Birth Project. Goal 2 is to study and learn the impact of the project. And we're seeing that already by some of the accounts that we have heard from moms and even the evaluation process that they're going through, that some have really been excited about it. I recall sitting in my car not too long ago in my community, and I saw one of the participants, and because I heard this baby crying, they were walking in the stroller, and I jumped out and I said, "Oh my God, you've had your baby." And she was sharing with her partner how, yes, this is one of the ladies from the Abundant Birth Project. So I'm super excited about what that has been like for her and her family and the benefit and value. Expansion goal 3 is make the case that this should be sustainable. This should be not a pilot, but it should go into like just continuance where we are able to have these guaranteed income programs throughout California, throughout our nation. And they don't just have to be short term, but they should be long term for various reasons. Goal 4 is to secure sustainability and public funding. And so that's where our goals are, and that's what we're working to achieve now. And I'll pass the mic to Lindsay, and she'll share more.
Thank you so much, Ajwa. Good afternoon, everyone. My name is Lindsay Richard. I am the Abundant Birth Project's LA County's program manager. So let's dive into where we're currently at with the Abundant Birth Project's expansion plan. So there are currently 4 participating counties. We have Alameda, Contra Costa, Riverside, and LA County. So we represent the LA County team, specifically within the Department of Public Health. Diving into the expansion breakdown. So as you can see here, each county has particular goals in place for the number of participants, in addition to income threshold, the monthly amount that will be given to the participants, and the actual duration. So I have highlighted here in bold LA County. So our goal is to have 400 participants in our program. The income threshold is 106,911, and if selected from our randomized drawings, a participant, or what we like to call our moms, will receive 807 for 18 months. So let's have a bit of a deeper dive into LA County's specific goals and sort of services. So as stated in the previous slide, our participants will receive, or are currently receiving, $807 a month for 18 months. So this is throughout the pregnancy and postpartum journey. This is an unconditional sort of gift, meaning that there are no strings attached. Ultimately, as was stated by the lovely Ajwa, is we want to assist our moms throughout their pregnancy and postpartum journey. Rent is extremely high and expensive here in LA County, so that additional support is much needed. Participants are offered optional one-to-one coaching. So we have amazing coaches that meet with our moms or our participants in an individualized setting to really help them with their social determinants of health goals. Our ultimate goal is to assist our moms throughout their pregnancy and postpartum journey so that when the 18 months finish and they sunset the program, they're not left with this huge gap for no longer receiving the 807. So we're actively coaching them and assisting with them with their goals so that they can be achieved. And again, our goal specific to LA County is 400 moms, and we officially launched in January of this year. All right, so a deep dive into where we are at with our specific numbers. Just as was stated by Ajwa and Aaron, our goal, and this is countywide as the entire program, is to have 950 moms by early 2025. So in total, from January to August 16, we are currently having, or at, I should say, 320 moms. So we're on track to that goal of 75% to have 425 moms by October of this year. Specific to LA County, as was stated, our goal is 400 by early 2025. So as of August 16th, we have 162 moms that are actively receiving services from us in addition to the cash gift. So we are 81% away from reaching that goal, the October goal of 200. So again, we are actively out in the community, really trying to bring about the necessary messages when it comes to this much needed service to our communities. So how does one apply? And we will put the links here. Referring particular candidates to our website is the first step. It has an in-depth guide on how to apply to the program. We have educational videos on what is to be expected and how to apply when it comes to our specific application. And then lastly, if you have any questions, please refer to our specific general email. We would be more than happy to respond, get your questions answered. In addition to any team trainings that may be helpful, we can come into that setting and actually present on our amazing program and the services that we are currently providing. And that concludes our particular presentation. I'll turn it back over to you, Erin. Thank you.
Awesome. Thank you both so much. I'm going to put their URL back on the screen here. And I just want to chat a little more. There are some questions coming in and really appreciate the presentation. Really cool information. Initially, just curious, lessons learned from San Francisco, applying them to LA and other counties. It's a unique position where there was a pilot program that started, and now you're sort of taking that model and applying it to a new location. So kind of curious what was learned from that and what, if any, changes are being applied to your expansion.
Lindsay, you want to speak to that and I'll follow up?
Yes. So I would say the main sort of lessons that are being learned is meeting our moms where they are at, meaning not only offering Zoom sessions with that individualized support in addition to in person. So the unique approach to the amazing Abundant Birth Project and us as a guaranteed income project is that we offer that coaching support, that individualized support to really help our moms with their social determinants of health goals. So it's sort of unique. And that was a major lesson that of course, our moms, our participants need the cash gift, but they also need support to really have someone be there that actually cares to help them navigate their overall pregnancy journey, in addition to postpartum journey. And I'll turn it over to Aja to add to that.
What I would add, which I don't think is, I know for a fact, like even from some of the documents that Dr. Zayas put out, like the racism in the economy, focus on health article that she has out. One of the things that we note is we try to take note of all of the issues that moms are currently facing. So at the time, you think during a pandemic, COVID, some of those challenges were around, getting needs met in a crisis. But outside of the crisis, we already know housing is a major issue. We've seen even more of a housing crisis need to be able to be more responsive to having support in real time from housing organizations, whether that be we have like HACLA, which is a housing authority organization here. We have trying to think of the one we have HOPICS, but we have some that are centralized to a region, but then we have our overall housing authority. Looking at partnering with them around the concerns and issues for pregnant and parenting moms and women. We also look at income and employment and the needs around that, whether it's education, whether it's also financial, I don't want to say fiscal I wouldn't even really say fiscal responsibility, but really how we better manage our funds and resources. And that just is for people as a whole, right? Because I've even seen some economic forecasts where we as individuals, our nation, have increased our credit card debt, right? So I can't put it to like, oh, well, because we're giving someone guaranteed income, that means that they can just go out and do whatever with their resources. A lot of times we're realizing that this is just to help offset some of just the overarching needs. We have food insecurity in our community, meaning that we don't have the best of markets available. Our food resources are looking at the costs associated with going to a farmer's market versus going to a grocery store, or encouraging people healthy options like every table versus going to a fast food restaurant. And so we're looking at the everyday piece of that, but then I'll end with this point. Is we're also looking at maternal mental health. And so providing resources to our moms, having just a number of resources available to them that will support them. from childcare to those moms that have special needs children, or those moms who've been informed that their child is at risk or they are at risk health wise, and then also the additional pieces of that, what that looks like for them, cost association. So I think that's some of the things that we're seeing a little differently, but maybe more expanded outside of COVID.
Yeah, that makes sense. And one more question, I think, before we switch over to miracle messages is, I know that a main goal of Abundant Birth Project is to kind of reach that level of evidence-backed and being able to take lessons learned and expand it beyond California. And you had mentioned that, guaranteed income leads to improved health. And in that quest for the evidence-backed label, I'm curious how you're quantifying, the ways that guaranteed income is improving health and how that's being used to, justify expanding the program.
Well, I would say the ways in which we quantify how guaranteed income improves health is we look at, for us, when you talk about maternal mortality and morbidity, we are looking at the fact that someone has a healthy birth outcome. We're looking at the fact that someone is able to really access their resources, their health insurance, and utilize them. We're looking at, even for their children or the infants that are born, their access to resources. We're also looking at, for some, this has been an opportunity to go back to school. For some have had the opportunity that they want to get in birth work themselves. So we're looking to hear the stories. And so since this project in and of itself is very new, those are some of the stories we're looking at. But if I reflect and look upon AIM, we realize, and when I say AIM is our African American Infant and Maternal Mortality Prevention Initiative, we're looking at a bigger project of work, a body of work, where we even do fatherhood engagement. How do we further support the dads, and how do we further support the partners and the involvement? How do we build relationships with our managed care organizations, with clinicians, with midwives, with doulas, and in order to help support and get those moms into the services? So we're quantifying, people are really accessing the services. They're learning about the additional services out there. They're starting to utilize them, and they're asking for more. They're saying, hey, this is what we would really need. So being able to get that feedback, even through the coaches, I think for us, that's one of the ways in which, or some of the ways in which we quantify.
And one more question that just came in.
Okay.
Yeah, just to add to that, just was going to just basically piggyback off of what Audra had stated. So we'll put that we utilize qualitative and quantitative metrics. So there's a multitude of factors that come into play with our research project, and just the overall progress and improvement that we're seeing with our moms. So I just really want to echo that point, that we are seeing a tremendous improvement and just overall progress when it comes to our moms, from the cash gift and the individualized support that we give our moms.
Awesome. And then one more question that came in before we switch gears is whether financial literacy support is provided to participants too.
Yes, there is. We are actually looking at building additional partnerships. We see a strong need for that for any of us. Like, I could still benefit, and I'm even, being a homeowner, or, I'm not just a mother, I'm a grandmother at this point. So I think we all could utilize that. And so we don't make this project or any of the guaranteed income projects about, making sure people are financially literate because they have just, they mismanage their funds. We do not want that to be a main focus. We realize that there is a need for additional cash. We realize that we have, like, one of the things we were going to share here, and I said, let's not do it right now. There's like a video on the racial equity gap, right? Or the inequity. It's like an inequitable race, right? And so we know that for long periods of time, there's been inequity. And so we're looking at that. We're talking about where there's housing discrimination, redlining. We went through this whole thing during the pandemic where one of the first things that was offered was like people not having to pay their rent, or because it might not be affordable then because of work, right? And so we're also looking at job security that helps, because one of the things that has always been a topic is time off for parents and having access to have time off, whether you have a medical issue or risk or your child has it. It comes into play for employment, whether you're going to be able to take that time. And especially if we have someone with a child with special health care needs, it can really present as a problem on a job. So financial literacy is at the top of our list. I just recently met with a gentleman who I said, at a guaranteed income summit, who I said, it'd be great to have you come and present and have us have an offering for the mom. So that is one of our additional topics amongst all the others that we have to offer via our coaches. Yes.
Very cool.
Long answer.
Well, thank you so much.
Yes, thank you.
Good answer, though. I'm going to bring Nellie back onto the stage, and we're going to switch gears a little bit. Thank you so much, Adjo and Lindsay. If you don't mind sticking around, we'll have time to circle back and answer some more questions. But I'm going to hand it over to Nellie to tell us more about Miracle Messages and Miracle Money.
Amazing, thank you.
Here we go. Bunch of slides up, or want to just give us a little intro first?
Yeah, I think we can jump straight into the slides and we'll go.
All right.
Awesome. Yeah, thank you so much for having us here today. I am a huge fan of the Abundant Birth Project, so it's an honor to be sharing space with them. And yes, so I am Nellie Stasny. I'm the director of Miracle Money with Miracle Messages. We are a nonprofit that serves an aspect of poverty that we often call relational poverty. We like to view it as relational resilience. We know when folks are experiencing homelessness, it is not the lack of housing that creates that experience, but it is often the loss or strain on our social support systems. And so we do that a couple ways. I'm based in San Francisco, which is where we started, but now we serve nationwide. And so our three main programs of how we work towards this aspect of relational poverty, building relational resilience, is through our reunion services, Miracle Friends and Miracle Money. As Erin mentioned a little bit earlier, is our reunion services, it's how we started. This program looks like when an individual experiencing homelessness, they record a message to a loved one that they have lost touch with. Our community of digital detectives then attempt to locate this loved one. In the last 10 years, we've reunited over 900 families. The average length of time people are disconnected is about 12 years. So, over a decade goes by, many people think that, they might not call home again, but we will try our best to make that happen if it's a good fit for them. Our second program that came about during the pandemic is called Miracle Friends. This is a phone buddy program, so it matches caring volunteers from around the world, really. We have many international volunteers. A lot of them happen to be based in the Bay Area. They are matched for weekly phone calls and text messages. We have well over 300 volunteers now and have logged over 100,000 minutes of conversations. This is something that came about really during the shelter-in-place hotels. We were seeing new levels of isolation and loneliness, and we heal in community, right? So how can we bring people together to have these support systems outside of a clinical sense, but really on just humans seeing humans? And, a double side of that was many people, when we would offer the reunion service, for very good reason, it wouldn't be a good fit for them, right? Either their loved ones or family members was not a safe space for them to return to. They could be right next to them experiencing homelessness as well. Or, maybe there's no one to reconnect with, which is not uncommon and really feeds the how can we create these new relationships through our Miracle Friends program. Our third program, which we'll talk more about today, is our Miracle Money. This is the direct cash transfer program. no strings attached, specifically for folks experiencing homelessness. And again, we were hearing from our volunteers, hey, my friend needs their car fixed. They have to go to work tomorrow. Is there any emergency funding we can access? My friend just got a new health diagnosis and has a specific diet that food stamps doesn't cover. Can we help with their groceries? And so we thought, okay, we should try to address this the best we can. Let's try to get into it. A theme that you really see throughout all of our programs is a big focus on narrative change. How can we shift the narrative, not just on what does it mean to receive basic income, what does it mean to give money with no strings attached, but also who are our unhoused neighbors and what stories can we share through this? A little timeline of where we've been and where we're going is in the winter of 2021, we did our initial Miracle Money pilot. In September of 2022, we launched a much larger randomized control trial with USC. And then this past July, we finalized our payments for that. And then coming this fall, we are calling it Miracle Money, 2.0, newer, bigger, better, taking our learnings and seeing what adjustments can be made. So that 2021 proof of concept was pretty small. We're hearing from our volunteers, our community has this need. How can we test it out? We had $500 a month for 14 recipients for 6 months. All of these recipients were located in the Bay Area, and it was through a nomination process. So those volunteers would come to us, nominate their friend, and they would receive those 6 months. The results from that were incredible with such a small group. 66% of those unhoused at the outset secured independent housing, so that's 6 of 9 recipients. 77 reported lower levels of psychological distress, and 100% felt more financially secure. This is all self-reported. And because of those really amazing results from our small pilot, we were able to do a much larger expansion, which we called Miracle Money California. For these folks, they were located in Los Angeles County, the city and county of San Francisco, and then the city of Oakland. It was $750 a month for 103 recipients for 12 months. In this randomized control trial, we had a total of 759 unhoused folks. And then for this, we partnered with the USC School of Social Work to measure those impacts of basic income combined with social support of our Phone Buddy program. So all of these folks who were receiving money had the option to participate in our Miracle Friends program. And in this last November, we had our 6 months findings come out. Some of these highlights included unsheltered time decreased from 30% to 12%, well-being increased by 13%, and then 87% of the spending was spent on necessities, mostly food, shelter, very small percent spent on alcohol, drugs, or cigarettes. And I also feel it's important to note that these 6 months findings are from folks who completed the baseline survey and the most current surveys up to this time frame. Some of our learnings, which I think is very important to talk about, and Abundant Birth Project spoke really beautifully to this, but we are so aware that the dollar amount we are providing individuals is not enough to overcome these systemic and societal barriers. But we do deeply believe that cash is an incredible additional benefit to existing social support systems and additional social services. Some of these barriers that we're seeing, though, are access to technology, financial literacy support, addressing the overlapping needs of individuals, institutional restrictions, addressing stigmas, and really tracking outcomes. How do we track such complex impacts that money have? But from this, it really shows a huge need for partnerships and collaboration across sectors, across organizations, about how we can best support people with this additional benefit, such as cash. Very exciting, Miracle Money continued, right? So what's next for us? After our final study results come out this fall, we are currently in the program design process to continue our basic income distributions, and we're exploring how basic income strengthens specifically our social support networks. So, right, how does cash impact our lives and the community around us and the way that we interact within that community? And currently we are in motion to distribute $5 million a year by 2027. I think it's really important to share an aspect of this story, right? We hear the numbers, we hear the figures, but who are the people being impacted by this money? And I wanted to share about one of our friends, Astara. Astara and I met in June of 2023. She has actually been a participant in all three of our programs. And so when I first met Astara, she was living in a shelter in San Francisco, operated by Five Keys. We met at this really amazing nonprofit that essentially operates like a coffee house, free coffee, come, sit down, relax. And I was offering our programs. And so she initially signed up for both the Miracle Friends and the Miracle Messages reunion service. She wanted to reconnect with her mom. It had been about 3 years. She left her house at a very young age because both of her parents were experiencing homelessness as well. Came to San Francisco, is an incredibly talented artist. And so we were able to reconnect her with her mom after 3 years of separation. I have the message that she wanted to share with her mom that she said I could share with you all that I think is just very beautiful. But to her mom, she wanted to say, I love you. I hope you're doing okay. I'm always praying for you. This past year, she was able to attend her mom's wedding, able to fly home, have that beautiful family moment. She's now housed thanks to a housing voucher. And most of this miracle money, she was able to contribute to her endeavors of being an incredibly talented artist. She was recently featured in a gallery show. Really amazing. The impacts, she still talks with her volunteer on a weekly basis. They share the highs and lows of life. But again, a very complex person with complex needs, as we all are. And these programs are really just meant to alleviate where we can, right? So very beautiful story. Astara is an amazing person. And it's been an honor to work with her during this journey. And yeah, we just deeply believe that everyone is somebody and should be treated as such. I have my email listed there, also my phone number for any outside comments or conversations that want to take place. Thank you.
Awesome. Thank you so much, Nellie. That was really cool. I'm going to put your website up on here for everybody. And then just had a couple of questions and then want to pull Lindsay and Adjoa back in just so, everybody can be here. But I think one of the things I found super interesting, comparing Miracle Messages and Miracle Money to Abundant Birth Project is, Abundant Birth Project started at its core as an income project.
Mm-hmm.
And you guys started and sort of grew into that space and thinking about other people, other organizations that may not be in the guaranteed income space, but may be curious, flirting, how to get into that work. So kind of curious lessons learned about creating a program and sort of building a program into an organization that is not a guaranteed income program from scratch.
Yeah. A big lesson for us is the idea of collaboration, right? We are a tiny but mighty team and we dream big. So that means that we have to create this community where we can do the work together. And it really grew out of like us listening to the people we serve, right? So many times we see so much red tape and barriers that exist that if there was only this much more, it could make a huge difference, a massive impact. And giving people the autonomy to use cash and they feel that meets their needs the best is often a way to bridge that gap. And so I would really push for the idea of collaboration, trying something new. As a nonprofit, it can be very scary to try something new when it is often a lot of pressure to maximize every single penny that we get, because there is a huge responsibility to serve the people that we do in the best way possible. But if there's that room, there's been enough studies and data that shows the impact of this work that I would really encourage folks to take the leap, start small, help who you can, and build out for a bigger and better future.
Awesome. Adjoa and Lindsay, I'm going to add you guys back just so you're not surprised, but would love to wrap this up with any final questions. And I don't know, I think it's an interesting theme that, you guys involved in this work all kind of stated in different forms, that this is not a silver bullet, and that there's a lot of other systemic issues in play, but that guaranteed income can just reduce the pressure and kind of the impact that that makes. And curious, something also that you guys all referenced was about connecting with other services, that like the money alone does not solve the problem. But Nellie, in your story, is about connecting people with permanent housing. Obviously, you know that is a very challenging system, and it takes time to connect people to those services. I know at Abundant Birth Project that it's you're working within a much larger medical environment, and so it's how to help reduce pressure on people's lives while also working within larger systems. So curious if anyone has any kind of closing reflections on the power and limitations that guaranteed income can play in this very complex interconnected spaces that you're operating in.
Well, let's be real. And sadly, it comes to this that, we have, I don't even want to say they're audacious or auspicious goals, but we have the desire to bring about change in our communities. Most of us get into this type of work, public health, community health, social services, and such, or even public policy and administration, to help folks, right? To build a better community, to build a better society, to improve our current situations. Or we've had our own lived experience, or we've known some folks, whether we ourselves have gone through any points of poverty or any points of lack, and we see the need. Sadly, most programs that initially get cut are those that, either are serving women and children, our public, focus, like Social Security. Oh, we're hearing about the cuts about Social Security. We're hearing cuts on various programs. Whether back in the day, everybody still complains about former President Ronald Reagan and him cutting mental health services. But look at how that impacted us decades later. How imperative it would have been for him to keep those services, or services cut for veterans even. And so we create these projects and programs, and then we have to fight for the dollars, or we have to find the funders, foundations, or individuals who are willing to fund this work. And then oftentimes it's always like, we need more data, we need more proof. I always say, especially as it relates to maternal mortality and infant mortality for Black folks, we got 400 years of data. There's no more proof needed. Let's just be realistic there. What the proof we need is the proof of a better outcome, a proof of the change, the proof of that allowing to have these funds available to show forth the efficacy over a period of time. Something that's been going on for decades cannot be resolved in 3 to 5 years without funding, and a lot of funding. If you're looking for 3 to 5 years, I'm talking millions, possibly close to the trillion. But if being realistic, we're saying allow us the time to work with what we have to produce better outcomes. But in order to do that, we need the funding and not the cuts. We don't need folks, lawsuits and things of that nature that present and try to turn the tide back. Like you said, Aaron, you watched the DNC for the last several days. No going back. We want to go forward. In all these efforts, we want to move forward. We want to ensure that, just imagine how any of these women and individuals feel, especially women and birthing folks. Reproductive health rights is on the big chopping block and the topic of conversation, and has been since the pandemic. The overturn of Roe v. Wade is more than Roe v. Wade. It's more than access to abortion care. How do, and as it's been shared, some women who have had miscarriages, the impact of that, a miscarriage, something that you could not control happening, and then you're going to be penalized for it. So imagine how that can also affect people in their pregnancy. All these other things, the economic inequality, or not having enough, impacts them to have poor or disparate outcomes even further causing them to be at risk. So I'm saying all that to say, it takes much more, and we need the support to continue these programs that are invaluable, not particularly just to us, but to those that are participants of it. Just hearing Nellie share about Miracle, and I love Miracle Money. I love, even your project is, invaluable to those that are unhoused, in need, right? It's hot right now. What about when it's not?
Well put.
Yeah, I'll stop so my other colleagues can share. But I just think, yeah, wow.
Okay. Nellie, thoughts?
Yeah, I mean, something that I don't think it's relevant for your exact question, Erin, but something that's really coming to mind is that everyone can play a role in this, right? Like, no matter where you are, where you're currently sitting, if you believe in this type of work, there is a space for you to advocate in, whether it's just elevating the work that is existing done. I don't know if I'm insane, but there's a space for everybody to fight for the objects that they believe in. And so, yeah, to learn how to get involved.
Awesome. Thank you. Lindsay, want to close us out?
Yeah, I just really want to elevate everyone's statements that when it comes to guaranteed income, we really are, for the most part, helping folks with their basic necessities, the basic things that are needed for what I like to really categorize it as our basic human rights, access to basic food, basic water for women and birthing people, basic female or oral hygiene products. So just thinking about that and that perspective is so helpful for folks that may be on the border of what guaranteed income is. It's just the basic necessities that we are trying to meet for many, especially when it comes to California and the high income sort of requirements that are needed to just really live here. So I'll close with that and really highlighting what Nellie stated as far as everyone can assist. Just sharing our programs out, sharing our flyers out to get the word out to folks that might qualify for these programs. It's just a basic step for us to really continue the fight for these programs to become sustainable and permanent. So I'll turn it back over to you, Erin. Thank you so much.
Awesome. Well, thank you all for joining us today. Really appreciate your time, really appreciate learning about the amazing work that you're doing. And to all of our viewers, thank you so much for joining. We'll be hosting another Population Health Matters in the coming months, I believe in October, for a new project coming out of Heluna Health. So hope everybody has a great weekend. Stay safe, and we'll talk to you next time.